Harry.
Hello, doctor.
Hi, nice to
Hi.
meet you. Take a
Nice to
seat.
meet you.
So, what seems to be the problem today?
Well, I have a lot of hair.
Huh?
Oh no, I shaved it all off for today. It's quite embarrassing to go out with it in public.
I see.
But normally this is what I look like.
Oh, okay. I think I can diagnose this as...
I looked this up online. On WebMD, it told me that I have Hirsutism. And it also told me I'm going to die in 3 days.
Oh no. Well, I can see where the confusion lies, Harry. You see, Hirsutism is something that generally happens in women, and it's caused by polycystic ovary syndrome. And it's when they grow hair in a male pattern, such as growing a beard or something. However, what I think you have is hypertrichosis.
What is that?
Well, Harry.
I know my name is quite unfortunate.
Yeah. Well, I think I have a video that might be able to help you here. Let's take a look. Hypertrichosis is a very rare condition that is characterized by excessive hair growth on parts or all of the body. There are several types, such as congenital hypertrichosis terminalis, navel hypertrichosis, or acquired hypertrichosis. Congenital hypertrichosis terminalis is basically when there's just excessive amounts of hair growth on the whole body. Navel hypertrichosis, on the other hand, is when there's excessive growths of hair, but only on a small patch of skin or, a small part of the body, such as a birthmark. These first two happen when there's a mutation on the X chromosome, which causes the gene that regulates hair growth to cause it to grow in excess. The last, acquired hypertrichosis, happens when an individual is not born with it, but rather develops it later in life. When we look at the skin diagram, we can see the hair follicles in the dermis of the skin of a normal individual. In individuals with hypertrichosis, there are a lot more hair follicles that grow in excess and rapidly. Thank you for tuning into the presentation. So, Harry, did that better help you understand your condition?
Well, yes, but could you expand on the last type she mentioned? Because this was not a condition that I had since I was younger.
Okay, yeah, sure. So, actually, in looking at your medical records, I saw that you had a seizure a few months ago. Did you end up using any medications because of that?
Yes, I use phenytoin.
Oh, I see. Well, you see, phenytoin is the #1 drug that causes drug-induced hypertrichosis. And I think that might have been the reason for hypertrichosis, actually. And, while you can keep shaving, you can actually try to go off of the drugs and maybe use a drug that also might help your symptoms. And in about 1 to 2 months of going off of phenytoin, your hypertrichosis should go away. Additionally, I know that this is something that can be really emotionally tolling, so I'm going to prescribe you some therapy. That'll be okay?
Yes.
Yeah?
Thank you very much, doctor. This has been very helpful.